help for many of my patients. Here's a SPECT scan of Rain, a 7-year-old girl who had been expelled from multiple schools for violent behavior. Rain's mother, Trish, said, I was ready to
I just told you I'll turn it down in a minute after I record this.
Every day, like clockwork, for 10 consecutive days.
No, I
As
said
a
no.
parent, I was simply exhausted and out of hope.
Oh my
Rain had a
God.
brain pattern we call the ring of fire.
I said no.
White hot, with
I'm trying to record this and it's making the words go away. I told you twice. Jeez, it wasn't recording.
To calm her brain, including
I know.
omega-3s, 5-HTP, and GABA, and eliminated gluten and dairy. Within months, Rain's brain became calmer. You can see a lot less white, and she is now in a new school that wanted to move her ahead 2 grades, and she has been on the honor roll and has won Writer of the Year and Most Empathic Peer. Trish told me that my child who wanted to burn down the school was finally not fighting her own brain. There are so many healthy ways to feel better fast, and nutraceuticals has been one of my go-to treatments for more than 20 years. The one tiny habit for nutraceuticals is to take 1,000 milligrams of omega-3 fatty acids for adults every day, either from fish oil or algae-based sources. It will take about 20 seconds and has been found to support your brain, eyes, heart, and joints. Not bad for one supplement. Strategy number 7. Be willing to go beyond what other people think of you and do the work you were put on earth to do. Caring about what others think of you is poison that leads to worry and social anxiety. I teach my patients the 18-40-60 rule, which says when you're 18, you worry about what everyone thinks of you. When you're 40, you don't give a damn what anybody else thinks of you. And when you're 60, you realize no one has been thinking about you at all. People spend their days worrying and thinking about themselves, not you. When I was a young psychiatrist in 1991, I fell in love with the brain imaging work we do at Amen Clinics, and it caused a radical shift in my thinking. I realized that many people who suffered with mental health issues really had brains that were working too hard, like Rain, not hard enough, or they were hurt or being poisoned. The scans decreased stigma because my patients saw their problems as medical and not moral, and they increased compliance because people wanted better brains. We stopped the shame associated with mental illness and started a completely new way to help people. Imaging grabbed my attention and has never let it go, especially when I could see brains get better. Chase, 23, struggled with anxiety, mood swings, and crippling panic attacks that caused him to withdraw from other people. From a checklist, the doctor diagnosed him with bipolar disorder, but the medications gave him side effects, including weight gain, which only made him more withdrawn. When he came to our New York clinic, his scan showed overall low blood flow to his brain, which caused us to ask why. It turned out his family was into racing cars, and since the age of 5, Chase spent a lot of time around toxic gasoline fumes, and he had a severe concussion from a racing accident. So many people are diagnosed with bipolar disorder after they've had a significant concussion. On a combination of nutraceuticals, including fish oil, L-tyrosine, and GABA, plus a brain-healthy diet, Chase lost 80 pounds, his brain was better, and he feels happier and more effective than ever. When I first started doing our brain imaging work, I was so excited, but got a lot of criticism from my colleagues who said the scans were just for research and psychiatrists shouldn't be using them in clinical practice, even though we were still making diagnoses like they did in 1840 when Abraham Lincoln was depressed. Did you know that Lincoln suffered from periods of severe depression, including being suicidal at least twice in his life? After a political setback in the winter of 1840, Lincoln's depression was so severe, his friends brought him to see Dr. Anson Henry. And how did Dr. Henry diagnose Lincoln with melancholia or depression? He talked to him, looked at him, and looked for symptom clusters. Then he diagnosed
It's done in
and
4
treated
minutes.
him without any biological data. That was 178 years ago, and it's the same way most people like Chase are diagnosed today. Think about it. Why are psychiatrists the only medical doctors who virtually never look at the organ they treat? Cardiologists look, neurologists look, orthopedic doctors look. In fact, all other medical specialists look, but psychiatrists are handicapped and make diagnoses based on whatever symptoms you report. Can you really imagine a future of psychiatry without looking at the brain? I knew we could be better, but at the time, I had two personal flaws that really got in my way. One, I wanted to be liked, but that doesn't happen to people who want to change a paradigm. Two, I hated conflict. It made me feel bad. But that all changed late one night in April 1995, when I got a call from my sister-in-law, Sherry, who told me that my 9-year-old godson, Andrew, who's also my nephew, attacked a little girl on the baseball field that day for no particular reason. I said, "Excuse me?" Sherry said, "Danny, he's different. He's mean. He never smiles anymore." I went into his room today and found two pictures he had drawn. One of them, he was hanging from a tree. In the other picture, he was shooting other children. In retrospect, Andrew was Columbine. Sandy Hook, or Parkland, Florida, waiting to happen. I told Sherry I wanted to see him the next day. When I walked into my office and saw Andrew sitting on my couch, my heart melted. I loved this child, was so worried about him. I said, "Buddy, what's going on?" He said, "Uncle Danny, I'm mad all the time and I don't know why." I asked, "Is anybody hurting you?" He said, "No." "Is anybody teasing you?" And he said, "No." "Is anybody touching you in places they shouldn't be touching you?" I was searching for answers to his senseless behavior, and he said no. My first thought was, you have to scan him. My next thought was, you want to scan everybody. Maybe this was a psychological problem. Then all of a sudden, the rational voice in my head said, "Stop it. 9-year-old children do not attack people for no reason. Scan him. If his brain is normal, then you can explore other reasons for his violent behavior." I went with Andrew to the imaging center and held his hand while he held his teddy bear and got scanned. When his brain scan came up on the computer screen, Andrew was missing the function of his left temporal lobe. It turned out he had a cyst the size of a golf ball, occupying the space where his temporal lobe should have been. By that time in 1995, we had already correlated left temporal lobe problems to violence. I called Andrew's pediatrician and asked him to find someone to drain the cyst. A week later, the pediatrician called me back and said he talked to 3 neurologists And none of them recommended we do anything about the cyst. They said it probably had nothing to do with his problems and wouldn't operate, and these are the words they used, and wouldn't operate unless he had real symptoms. Confused, I said, I have a homicidal, suicidal boy who attacks people for no reason. What do you mean by real symptoms? I think they mean seizures or he loses consciousness, the doctor replied defensively. I said, this is insanity, and hung up. Frustrated, I called the pediatric neurosurgery department at UCLA and talked to Dr. Jorge Lazaro, who later became famous for separating the Guatemalan twins who were connected at their heads. He was famous to me before them because when I told him about Andrew, he said, when cysts are symptomatic, we drain them. Obviously, Andrew has serious symptoms. No kidding, I thought to myself. After surgery, I received 2 phone calls. One was from his mother, who was so relieved. Sherry told me that the surgery went really well, and that when Andrew woke up from it, he smiled at her. She said, Danny, he hasn't smiled for a year. The second call was from Dr. Lazaro, who said, oh my God, Dr. Aiden, that cyst was so aggressive and put so much pressure on Andrew's brain that actually thinned the bone over his left temporal lobe. His temporal bone was eggshell thin. If he'd been hit in the head with a basketball, it would have killed him instantly. Either way, Andrew would have been dead in 6 months if you hadn't persisted. That day, I became even more passionate about our work. And I didn't care anymore if you liked me. And I was ready to take on the fight of my life. When someone's behavior is off, how do we really know why? Unless we look at the brain. Now, 23 years later, Andrew's married, employed, owns his own home. Because someone thought about his brain, he's been a wonderful son and husband and will be a better father and grandfather. Since Andrew, we have seen patients from 120 countries, published more than 70 scientific studies on our brain imaging work, and Discover magazine listed our research as one of the top 100 stories in science.
Oh, hallelujah. I love you, John. I love you, John.
What anxieties or beliefs are holding you back from fulfilling your mission on Earth? You can overcome them to do something important, but you first have to be willing to go beyond what other people think of you. The tiny habit for this strategy is to ask yourself every morning, what one purposeful thing will I do today to support my family, my profession, or my community? Purposeful people live longer, are happier, and even have less risk of developing dementia. I started this program by saying nearly all of us have felt anxious, sad, exhausted, or hopeless at some point in life, or we know someone who has. But when you put these 7 simple strategies into your life, you can feel better fast, and it will last. And it is not hard. Chris overcame her grief, and Steve radically improved his memory by using strategy number 1, optimize the physical functioning of your brain. Chloe used strategy number 2 to decrease her anxiety. She trained her mind to help her rather than hurt her by killing the ants or the automatic negative thoughts. Leo used strategy number 3, medical hypnosis, to calm his busy brain instead of using marijuana, which was only hurting his brain. Sarah replaced the alcohol with strategy number 4 the ultimate brain-based therapy, where she used all of her senses to flood her brain with happiness at once. Will regained his desire to live again by using strategy number 5 to naturally boost serotonin. Bryn and Chase dramatically improved their lives with strategy number 6, using nutraceuticals as first-line help. And I could live my purpose and help incredible people like Andrew by using strategy number 7 and go beyond what other people thought of me and do what I was put on the earth to do. And you can too. Take a minute and ask yourself, who needs this information? Who do you know that needs to feel better now? Is it
My
you?
son, John.
Is it someone you love? Put these 7
Yes.
strategies into your life and
It
notice
is.
the dramatic difference they can make in your life, and then give them away to someone you care about. You can feel better fast, and you can make it last. May God bless you.